aftermath of 9/11 when you were a senator from New York, and he came to you for help in getting services to traumatized children. We've come a long way since then. Can you give us a sense through your eyes of just how far we've come at prioritizing children's mental health issues since then?
Well, Willow, first, let me start by really applauding the Child Mind Institute and thanking everybody who's a part of it, everybody who's a part of the staff and the support system and the board and everyone who understands the vital importance of this organization and the work it does. And you're right, I met Harold more than 20 years ago. He and I began to talk about healthcare when we were attempting to change healthcare and provide better services for everyone, but particularly for children, which was my priority. And the Children's Health Insurance Plan, which we passed with bipartisan support at the end of the 90s, which now provides healthcare for 9 million kids, which, by the way, has not been reauthorized by this Congress. And by the end of the year, kids will start losing their health care. And so Harold and I shared a common interest in trying to get better access to high-quality, affordable mental health care for kids, to deal with and try to diminish, hopefully someday eliminate the stigma, to support more and better research, because I think it's still the case that even today, only about 5% of the National Institute of Health budget is allocated to the National Institute of Mental Health. So we certainly have improved people's awareness. We have learned a lot more, and Harold is the expert on this, about how best to treat children and adolescents. You just heard from this extraordinary young woman, Alex. There she is. Thank you for being here and speaking out, because you are not only doing so much to demonstrate your own personal growth, but helping other people. So thank you for that. So I think on several grounds we've made progress. You know, we passed a law about parity between physical and mental health. It is nowhere near being implemented the way it should be, but at least we got it on the books. Hopefully it stays there. But we're not funding, we're not speaking out, we're not doing enough to try to continue the progress to give people the tools they need in their homes, their communities, across our country, to both recognize and deal with mental health challenges. So I guess it's a good news, bad news story. And this new report has a lot of good news in it, because it does point in the direction of what can be done and what more should be done by combining treatments and raising awareness. But I think that anybody who is concerned about this, as we all are who are here today, knows we have to do a lot more.
So I'm the more optimistic. You know, I think that, but I think anyone who starts a not-for-profit in 2008 has to be
Right.
very optimistic, or maybe So I think that the world of psychiatry, and particularly child psychiatry, is being transformed by science. I think the idea that we know so much more about the brain in the last 25 years has changed television. You know, people think neuroscience is cool. They think we can, you know, figure out who the murderer is with neuroscience. But more importantly, we can now tell the difference between the brain of an atypical child versus a typical child. And in the next 10 years, I think we're going to be able to tell the difference between one atypical and another atypical. So the way to think about that is that if the three of us are coughing, we don't all have pneumonia. And with a simple blood test, we can tell that one of us one of us has pneumonia.
That's what I thought, right?
One of us has a virus and one of us has an allergy. But can you imagine if we're all fidgety or inattentive, we don't all have ADHD. And if we can get to the point where through brain scans, through EEGs, through a complete comprehensive database of the developing brain, we'll be able to tell the difference between one child with one disorder versus another. And I think an objective test will also have a tremendous effect on stigma. And I think there we're making progress too. If you would have told me 25 years ago that the royals of Great Britain would be talking about it, that Prince Harry and that Prince William and the Duchess of Cambridge, I would tell you it's hard to believe that they're saying it's real, it's common, it's treatable. And that's the same with Emma Stone and Jesse Eisenberg and a whole bunch of heroes that we identified this past May. And I think the last thing is that we have some better treatments. And those treatments don't seem to be coming from medications. The new medications in the last 25 years have been there's been very little in mental health. But whether it's cognitive behavioral therapy or dialectical behavioral therapy or parent management, these are evidence-based psychosocial interventions that work. But we still have a lot to do. I mean, we can talk about the barriers there, but I think we have a lot to be hopeful for.
So I'd like to spend a good chunk of time unpacking your new report, which focuses on the state of adolescent mental health. Can you, though, just situate adolescent brain development in the continuum of the phases, the most important and critical phases of brain development starting in early childhood?
Sure. So we know that the brain changes over time. There's a reason why we know that at 3 years old, you're going to have 10,000 words, and at 2 years or 1,000 words, and 2 years old, you're going to have 100 words. That at 5, you're going to be able to sit long enough to be in kindergarten and maybe wait your turn. But we also know that dramatic things happen to the teenage brain, that at 13, there's almost a revolution. We start pruning the brain and get rid of parts of the brain that we don't use. It's kind of use it or lose it. And that exciting time between 13 and about 24 is something we're learning more and more about. And so it's easier to learn. You still can get a foreign language. You can still learn to ride a bicycle. There's a whole bunch of things you can still do that become harder and harder when you get older. And the one thing we also know is that it's also a good time to get bad habits because the brain is very plastic. It's easy to learn things, but it's also easy to get dependence. It's easy to get addicted to drugs. And at 24, you start getting your prefrontal cortex, this part of the brain that's in the front of the brain, starts communicating to the rest of the brain. So you start learning about strategy and cost and risk. You put on a helmet. You're more likely to put on a seatbelt. And Hertz will let you rent a car at 25.
Yeah, somehow the car companies knew about
right.
this before the scientists did.
Right.
25 being kind of the...
And we should warn mothers of boys that boys are slower, and it can sometimes be 27. And if you have a psychiatric disorder like ADHD, it could even be later than that, which means that the impulsivity and the aggressiveness of the brain of an adolescent can not only be great for exploring new things, it can also be very dangerous.
So the things that we see anecdotally in teenage years, that heightened, it matters so much, that heightened state is actually tied to very specific functions, developmental functions in the brain.
Absolutely. In fact, we know that there are centers of the brain between 13 and 24 where emotion is more highlighted. So when your teenager says to you, I'm freezing or I'm boiling, they really are freezing or boiling, or I hate this, or I can't believe how terrible this is, saying to them, it's not so terrible, doesn't really identify the problem. You should recognize they really believe that emotion because they're feeling it.
So what are the major risks of adolescence?
So the onset of 50% of all psychiatric disorders occurs before the age of 14 and 75% before the age of 24. And so we also know that suicide between the ages of 13 and 24 are not only the suicide completers, around 5,000 kids every single year in the United States will complete suicide. 600,000 will make a serious enough attempt that they will actually land up in an emergency room. So if we know that there's this contagious quality, we have to recognize what else is going on in the world. So we talked about this briefly in TV programs like 13 Reasons Why, which glorify suicide, which basically tell you that the dead girl lives on. She has power in the classroom. She's glorified. People feel sorry. People want to tell her things. Really takes a terrible toll on certain teenagers who are thinking about suicide, and therefore that media can actually have a very negative effect on a group of teenagers.
So one of the alarming statistics that emerged from your report is that suicide is now the leading cause of death worldwide for girls 15 to 19. Why are girls at greater risk?
So there's actually gender differences in the brain, and that we know that sex hormones are actually higher during adolescence, and those centers of the brain may be the difference that we see in mood disorders, anxiety disorders, once a girl hits puberty.
And we also know that the incidence rate increases around the time that school starts.
Yeah.
So what does that tell you or tell us about what we may need to do differently at school?
Right.
Well, I think we have to do things differently everywhere, and school is one of those. And, you know, in listening to Harold and reading the report, I really think just a key to this is making sure that information is more readily available to people who interact with kids, parents, family members. Alex's story about her mom, which was so incredibly moving. You know, people have to understand this, because this may have always been the case, Harold. I don't know. You have the probably historical data. But it just appears to me that at least the evidence of anxiety and depression and other kinds of, you know, mental health challenges are much greater today than they were. And I'd love for you to talk about social media, but to Willow's question, you know, schools have so much, we dump so much on schools to do all the time. And we expect teachers and counselors and everybody to be experts in everything having to do with kids. And indeed, there is just such a gap between maybe what their knowledge is about the very things you were just talking about, brain development being at the center of it, and their confidence that they can do anything about it. And what are the best interventions? How do you try to help an individual child? How do you try to set a better environment for the classroom, for the whole school? You know, what is it that, you know, schools in particular can do?
So I think that we historically have seen schools take up health education in remarkable ways in the last 30 some odd years. So when I went to school, sex ed was taught by a gym teacher, and you never knew he was talking about sex. You know, it was somehow, it was some kind of, you know, video or some kind of film. And after the AIDS epidemic, it is truly amazing how parents wanted schools to take charge of talking about this virus, talking about how you can catch it, talking about how you can be safe from it, what do you have to do, and kids learned about that. And we just talked about how terrific it is to learn between 13 and 24. So middle school and high school is a great time to get information. And I actually believe that mental health curriculums should be standard in every middle school and high school. So if you want to destigmatize something, you want someone to know, oh, you know, it turns out anxiety disorders are the most common illnesses of childhood and adolescence. Let me understand the difference between just being anxious and having a disorder. And the more facts kids get, the more understanding about their brain development, I think there's a possibility that you can start talking about the bad things that can happen to your brain. So marijuana can be very, very bad for a teenage brain. You are more likely to become dependent if you become a regular marijuana smoker during adolescence than if you start smoking marijuana after the age of 24. That doesn't necessarily stop people from doing it, but knowledge about this, understanding how you have to take care of your body, and kids are exercising more, they should learn how to take care of their brain.
Can you walk us through this issue of anxiety? You mentioned, and Secretary Clinton, you asked, is the most common mental health disorder in the United States affecting nearly 1/3 of both adolescents and adults. Are we seeing the rise of anxiety disorders? And if we are, why?
So I would think that, number one, we're getting better at identification. And therefore, whenever you identify something, you're going to see an increase. But let's talk about what anxiety disorders are. So it's normal to be anxious at the right time. In fact, our brain lights up if something dangerous happened here. If someone came in with a gun or someone started yelling, your amygdala jumps up and says basically fight or flight, run away or beat that guy up. That's a normal response for your brain, and it's healthy. You're walking down a street, you hear some noise, you get your body, your brains alert you, be alert, something's going on. When someone has an anxiety disorder, they have a false fire alarm. Their alarm is going off, and there's nothing to be worried about, and they can't calm it down. Now, that can really interfere with functioning. You'll stop going to school. You won't talk in front of other people. You can't stop washing your hands, even though you know washing them once is enough. And that interference and that endurance, that if it lasts for more than 2 weeks, that's what makes it a disorder.
What triggers it, Harold?
So,
crossing the line between sort of ordinary garden variety anxiety to the disorder.
So it turns out that anxiety is 35% genetic. That doesn't sound like very much, but there's also something called assortative mating. Anxious people find anxious people to marry. And so when I read this study when I was in residency, I said, oh, nonsense. But it's, think about it. So for a lot of kids, it's 70%. That every time their mom and dad make a baby, there's a 70% chance they're going to have anxiety. So I think the way to think about it is the genes load the pistol and the environment triggers it. And there are things in our environment that are making people who would have low level of anxiety have an anxiety disorder. So, just watch television now. There seems to be one episode after another of terrifying things going on. That you go to church and people could shoot you. You go on the street and someone is shooting you. You go to Las Vegas and someone's shooting you. You go for a walk in New York City and someone takes a car and tries to hit you. For the average person, it is amazing how we block that out and say, oh, statistically that's not going to happen. Of course, I'm going back to Las Vegas or I'm going to church on Sunday. But for the person who's genetically loaded and has that minor, sub-anxiety, that kind of event, even though it was 1,000 miles away or 2,000 miles away, triggers it off. So they might say to their mom, I'm not going to school tomorrow. It's just not safe. I don't want to do it.
And what about social media?
So social media, I think, is great and awful at the same time. So we know that the internet has been terrific for marginalized groups. For kids who've been feeling very lonely, they can find others who are experiencing the same thing they have. And yet, at the same time, we know that kids who watch, teenagers who are doing social media more than 10 hours a week, in 8th grade report that 56% of them say they're not as happy as their peer group. So it can be toxic. The other thing that I think we have to be very concerned about is the fact that there is material on the internet that is toxic. Mm-hmm. We've heard of teenagers who get radicalized by dead people who have videos still online and that they can self-radicalize themselves from that. So for certain individuals, particularly teenagers, where they have more aggressivity, they're more impulsive, they're more detached, they're more disenfranchised, the power of the internet can be really quite toxic.
So for a teenager, and I particularly boys
Yes.
in the case of radicalization, something about the teenage brain makes you more vulnerable
Right.
when exposed to the same stimuli.
So Willow, your mom's in the audience, so I can say this and check with her. When you were a kid and you did something, you said, well, I want to do this because everyone else is doing this. Your mother would say, what, if they jump off the bridge, will you jump off the bridge also? And the truth of the matter is there's lots of teenagers who will jump off the bridge if their friend does it. There is a contagious quality to wanting to belong. In fact, there are centers of the brain when you're around 15, 16 years old that make you more self-conscious. And that if you're with people who are doing bad things or doing something that you might not want to do, you're more likely to do it when you're in that group. And so the internet can play that role so that you already feel uncomfortable, you feel isolated, and yet by following this group, we find people who will do irrational, stupid things like jumping off a bridge, so to speak, but feeling the need to belong. And that means that we may have to think about, YouTube just scrubbed a whole bunch of videos. We must have to think about what the role of parents are in moderating and monitoring what our kids are watching and what the effect is.
Right. Can I ask you, Harold, is there any way the internet could become more helpful in sort of interrupting these cycles of needing to belong or getting anxious? Could there be a much more concerted effort on social media to try to put messages out there for teenagers so that at least there would be some warnings and some breaks that might be available?
Right. So if you think about something as simple as Netflix and 13 Reasons Why, if you would put in the middle of that program the equivalent of commercials, these interrupters that say, if you're feeling really uncomfortable now, please get your parent, please call this number, please text here, that becomes somewhat more socially responsible. But the internet is responsible for certain things. So for instance, movements like It Gets Better, which was started by Dan Savage, about gay kids, that they had higher rates of suicide attempts, that it gets better if you can hold out, if you can know that you're not alone. The campaign we did, #MyYoungerSelf, has had a really positive effect on kids who watch famous people talk about their mental health disorders. But I think that this takes a much more sophisticated approach to think about how we reach boys in particular who feel disenfranchised, feel isolated, and how we make them feel like they belong. I mean, I'm the child of immigrants. My parents were the most, patriotic. They never missed an election. I'm super proud of being an American, and yet we have a group of new immigrants who, not always new immigrants, but boys, always boys, under the age of 26, who somehow feel that this country doesn't have the opportunity for them, or they are at the short end of the stick. And how we can engage them in a protective way is really something I think we as a nation have to give a high priority to, because it's not like the devil's outside. The person who can get contaminated by this is already living here.
So given what we are beginning to learn and beginning to understand, not just about social media, but about the power of technology and technology design, that we know that this technology, for all its good, is affecting human psychology in ways that we did not anticipate. Is there a role for policymakers to play here in regulating, offering guardrails to tech companies who really fulfill a unique role in our culture, in our global culture today, that was not in existence even just a decade ago?
Absolutely right, Willow. Yes, I think there is. And this is an opportune time because there's a lot of questioning and even soul-searching going on about technology. Clearly, what happened in the election raises it, but it's much broader than that. And it's a discussion that we need to have because I really think there can be and should be guardrails. Taking down those videos of Al-Awlaki, the former cleric who was still radicalizing people years after his death. These are the kinds of things that there should be both self-regulatory discipline and outside pressure. And, back in the 90s, we were really concerned about video games, remember? And the role that video games played in, really desensitizing kids, again, predominantly young men, to violence. And it's not that we changed the whole industry, but by talking about it so much, by raising some of the warning signals, by having conferences about it, more and more people became aware. And also, I think, and again, Harold knows so much about this, but I think it also gave even gamers the idea like, okay, I know this isn't real, as opposed to just being so dragged in and made a part of this fantasy world where, you win by, killing, hundreds of people. So I think with respect to social media, there has to be greater vigilance, and not only from the government, but from parents groups, organized efforts by mental health groups to keep beating back this idea that somehow it's both good, it's both bad, and all goes out in the wash, because if people are vulnerable, it's mostly bad.
Right.
And because we don't know exactly who is most vulnerable, and we can help parents and teachers and others, try to recognize symptoms, but we may not have enough understanding to intervene unless we do put those guardrails up.
And if you think about it, historically, we've done that. The whole issue of pornography.
Right.
you had to be a certain age. I'm going to show how old I am to get a subscription to Playboy. And you couldn't go into a drugstore and buy one unless you were a certain age. Today, because of the internet, children are exposed to material that is really, in my opinion, difficult for them to understand, overly stimulating, unrealistic, and sometimes very addictive. And so therefore, helping parents know what kind of safety blocks they should put on the internet, what kind of discussions, how much time your kid should actually be on a screen every single day. And that's not easy. I'm not suggesting it's easy, but we historically have done that. We know that not everything is for a child. You can't go to a movie if it was X-rated or NR, or there were certain things that would stop you. And I think the internet needs to understand that also.
And it's clear, at least I believe that it's clear from the evidence, that it's heavy users whose risk goes up for mental health challenges, goes up exponentially.
Correct. So I think the good news about adolescence is great time to learn, right? Great time to absorb things. If you think about fashion, when I was a kid, I remember that I made my father listen to a Beatles song. And I remember he's Eastern European, Holocaust survivor, significantly older than the other dads, listening to I Want to Hold Your Hand. And he was trying so hard not to grimace. And that, 30 some odd years later, my oldest son was a DJ, and at the time they would scratch records. And I thought, this is worse than I Want to Hold Your Hand. And I tried not to grimace, right? So adolescents always push the envelope. The fashion, the whole music scene, everything that we see on billboards is not of people our age, but of people who are young and who are willing to push the envelope. And that's something we don't want to get rid of. But simultaneously, we know that this is a risky period. Literally, you upgrade 3 times dependency if you start smoking marijuana. You are less likely to be able to stop smoking cigarettes if you start at 14 and start smoking on a daily basis. That benzodiazepines, Valium-like drugs, you can increase almost 2 times your dependency. So being a parent of a teenager is very challenging, and being a teacher of teenagers is very challenging. But that doesn't mean that we can't provide people with more tools and more knowledge. I think of, this is a country that tackled polio. That when I was a kid, they threw you in the back of a station wagon with 6 other kids rocking around. And, you get into a taxi cab in New York, and if the cab driver doesn't tell you, the sign comes up saying, put your seatbelt on. And we tackled AIDS. It seems to me that if these are the most common illnesses of childhood, literally 1 out of 5 American children up to the age of 18 will have a diagnosable mental health disorder. That's more than asthma, peanut allergy, cancer, diabetes combined. Then this is a national health problem that needs to be tackled with lots of different things. But one of them is more information for the teenagers themselves, for the parent, and for the teacher.
Harold, could you say something about how interventions and treatments work?
Right.
Because I do think that's not widely understood, and too many people perhaps believe that there's really no reason for them to express their feelings because nobody's going to listen and nobody's going to be able to help.
So I mentioned there's this great news with these evidence-based treatments. So there are studies that can show you that in depression, anxiety, and in ADHD, short-term treatments that are around 12 weeks of a combination of cognitive behavioral therapy along with medication, 81% of the individuals with an anxiety disorder get better. 71% of kids with depression get better. And 68% of kids with ADHD get better. Now, there's no other set of illnesses that has that kind of treatment rate. Now, there's a problem. Kids are afraid to go. They're stigmatized. There's lack of access. And very often, it's hard to keep a teenager engaged and saying to them, we can do this. It's not you who's sick. You have an illness. It's not that you're crazy. It's this illness. But when you can get a kid to stick to the treatment, these results are extraordinary. And again, I don't think most people recognize how effective mental health interventions are.
And what do we know about getting kids to stick to treatment?
Yeah, so it turns out there's some tricks to it, but it's not great. 50% of the kids who start drop out very quickly. There are actually techniques like motivational speaker type interventions where they engage with the therapist who basically says, I'm your partner. We're going to fight this together, seems to be the best way to go. A passive approach doesn't seem to work. The classical thing we think of, you go to the doctor, you lie on the couch, he's quiet, you're quiet. That doesn't really work, particularly for a teenager who's not really enthusiastic about being there. But you find that, anecdotally, I can tell you that when someone comes back to see me, and I've been doing this a long enough time, that someone came back to see me 25 years later. They were 32 years old, and they walked into the room, and they said, the best line, they said, Dr. Koppels, you haven't changed at all. So I said, well, if that's true, then you need an ophthalmologist, not a child psychiatrist. But what he said that he remembered when he was 7 was that I was on his side, that I told the truth when I said the teacher was too tough on him, that while he didn't want to take medicine for his ADHD, he knew that it wasn't that he was being punished. And I think that when a therapist is capable of saying to a kid, we can get through this, it is really a time-limited approach that's very effective. And nothing makes a kid feel better than relief of his symptoms. It's really, left untreated, depression, anxiety, kids start self-medicating, and they use the worst medicines. They use marijuana, they use alcohol, which we just said was terrible for their brains.
So significant success with treatment. But, I will tell you, through the lens of a university administrator, we can't treat our way out of this process right now, this problem right now. We're overwhelmed.
And we have a shortage of people.
With the need for counselors. So, and frankly, our folks are asking, what can we do in terms of prevention? So what do we know about the adolescent population and what messages will resonate with them before we get to a crisis point?
Look, and could I just add to what Willow said, because of her experience at USC, but every college administrator that I know across the country is just so worried about the increase in students suffering anxiety, depression primarily, and the overload on their meager health facilities and their inadequacy of being able to treat it. Is there some more population-wide effort, take sort of general population and then take the college population? Because I know that a lot of administrators are really struggling with the best approach here on a broad base.
So I think the good news about colleges facing this is that more kids are going to college today who have a diagnosis and have a treatment. Mm-hmm. So that didn't happen in the past. And also, if you went to college and you got sick, you went home and you didn't come back. They wrapped you up and sent you home. And today, colleges are taking on the responsibility. In fact, it was Larry Summers, when he was president of Harvard, who actually said the fastest growing budget was the mental health budget at Harvard, because he was pleased to say he was taking kids from all over the country who traditionally wouldn't have been able to travel that far because of their mental health. So I think there's a few things. Number one, I think colleges have a responsibility to know who their patient population is. So once you get into school, once you're accepted, I think not only should you hand in your physical exam, but you should do a checklist so you know at least which of the kids or what percentage of the children students might need more help. I think student bodies need to have real campaigns. So the number one thing college students don't do, and is very dangerous not to do, is sleep. And we know that if you are an adolescent and you sleep less than 7 hours, you are more at risk, if you already have that risk for psychiatric illness, to start becoming symptomatic. And we don't talk about it. And certainly we don't sell it at school by saying, sleep is sexy, sleep is necessary, sleep is, because we just take it for granted that college-age students don't sleep.
Well, but also to your point of how important it is to start these conversations in junior high school, in middle school.
Right.
Those are the kind of conversations we should be having with our 13-year-olds.
Correct. So first of all, I think every family in America should have at least 20 minutes a day without screens. It's kind of like you go to a restaurant and I sit down and it takes all my self-control not to get up and shout at a family where the father is doing this and the mother's got earpiece and the kids are watching movies why are you sitting together? Yep. But everyone should have at least 20 minutes, and in those 20 minutes, you should have a guided conversation. Parents should talk to their kids about what they did that day, what went well, what was challenging, and so that everyone knows that there's that 20 minutes. But also, you should talk about the difficult things that, why sleep is important, look, exercise. There's a lot, while we have an obesity problem, there are a group of young people today in their 20s who exercise as though it's part of their life. They do it on a daily basis, which you don't see that many 60-year-olds and 50-year-olds doing. So you can change the way kids behave, but it's really important that parents deliver the message. I think also you should know that while those centers of the brain at 15 make you more susceptible to your peer group, throughout your entire adolescence, your parents are still the most influential people in your life. There is no doubt that what your mom and dad say on a regular basis really affects you. And the important part about that is most parents pull back. They say, but everyone's doing it. And if you have a strong belief in whether or not it's going to church or something about premarital sex or about substance use, you have to keep that conversation going. And if you don't have that 20 minutes, if you don't say dinner, breakfast, sometime we're going to be talking about it, the other voices that the kid listens to, whether it's in person or on the internet, become much more powerful and influential.
I'm looking at the questions from the audience, so thank you all for submitting them. I'm wondering if there are a lot of doctors in the audience, because some of the handwriting is very hard to read. So excuse me if I might hand them to you to see. But if it's okay with
Please.
you, there's one that's relevant, and it's from Lori Bernstein, who's a high school guidance counselor in a New York City public school. And she writes, so many people agree we should have a mental health curriculum, but how can we get the powers that be above the principal to value this with time and money? How can this even be part of the conversation when a teacher is evaluated?
Well, I think this is one of those areas that has to be made a priority, and groups outside of the education system, like the Child Mind Institute and so many others, need to come forward with a curriculum to the boards of education, to the administrations of school districts, and just lobby like crazy to get those into teacher training, into school programming. And I'm not saying it would be easy, and some parts of the country it will be harder than other parts, but if there could be some standardized approach, and I'm really looking at you, Harold, and your colleagues, because you can't expect educators to do it, and you don't want some drug manufacturer who's basically just pushing the drug piece of the treatment. You really want the experts, the professionals, to come up with such a standardized approach. Then I think we would have a fighting chance, and individual teachers like this woman would have something to turn to and can say, well, there's a standardized approach that's been adopted by the American Psychiatric and Psychological and all these other groups, so let's get it into our schools. And I know here in New York, mental health is becoming a much bigger priority for the de Blasio administration, so there might be an open door to push on, and then other places around the country just need that kind of attention and constant persuasion to get it accepted and then implemented.
And I think there's a way to piggyback this also on helping teachers with behavioral management. If you look, we've been working with Teach for America, and Teach for America is terrific at teaching these really brilliant young teachers how to teach kids to read and to write, and many of them burn out because they can't manage the class. They feel incompetent and impotent when kids are so disruptive. And when you teach them skills on behavioral management, they feel very grateful. They feel empowered. And I think simultaneously, if they could understand, behavior and then teach it, would be not only exciting for science curriculums, it'd be exciting for healthcare. It could be something that just becomes part of the culture of the school.
And is there something you could share? We've got the village sitting here.
Right.
About, for example, behavioral management that we could all take away.
Right. So I wish I still, my kids were younger, so I could practice this. But so I think it's very unique, something that we do at the Child Mind Institute, which is parent management training. So you have a child who's very oppositional and defiant between the ages of, let's say, 3 and 7. The parents don't want to use medication, or the medication has too many side effects. And we try to teach the parents 3 things. We try to teach them, try to grab a positive behavior. And when the child has positive behavior with an earpiece in their ear, we tell the mother, praise the child very specifically. Thank you so much for spending the day with us, this hour with us. I know how busy you are. You're so attentive. You're so intelligent. I really think it's wonderful. We don't say that to our children. And so we grab that. And then this is the hardest part for parents. You actively ignore insignificant off-task behavior. So your child is talking with their mouth full. They didn't put the napkin on their lap. Basically, you find yourself always giving negative stuff instead of ignoring that. And then how to intervene when your child does something really quite awful, kicks you, curses at you, throws something. And when teachers understand this, they start spending a lot of time complimenting kids who are sitting quietly, ready to learn. Or the kid who raises their hand and say, thank you for raising your hand, Willow. I'm not going to call on you, but I really appreciate that you raised your hand. And changing that, it seems silly, but if parents on a regular basis actually paid attention to positive behavior and labeled it specifically, it really it puts money in the bank so that when you do have to say something negative, the kid can actually hear it and process it properly.
Sounds like that might work for adult to adult.
It might also be good for marriages,
If I may go to another audience question. Let's see. This is a bit of a, can we address mental health issues without better addressing racism? And this comes from Jeff Ginsburg, East Harlem Tutorial Program. He situates that into context by saying that the opioid crisis is being discussed in very different terms than the crack epidemic of the past. Students of color with emotional lives seem to be suspended at much higher rates than white children. Therefore, can we address mental health issues without addressing difference or racism?
Right. The sad part about child mental health disorders is that they're equal opportunity disorders. Rich or poor, black, brown, or white, or yellow, we all get hit with the same percentages. What's really troubling, though, is the rates of treatment. So kids in poverty, kids of color, not only because of a lack of access, but because of more stigma related to these disorders and a lack of awareness in many communities, are less likely to get help. And if you have a psychiatric disorder, something as simple as ADHD, you are significantly more likely to have academic failure, and you're more likely to drop out of school. And if you're in a poor neighborhood or you're a kid of color, you're much more likely to get involved with the juvenile justice system. And once you get involved with the juvenile justice system, bad things really happen. And so now when we look at the juvenile justice system, 70.4% of the children who are in juvenile justice meet criteria for a psychiatric disorder. So we have taken a bad juvenile justice system and made it into a terrible mental health system. So we have a big problem in this nation about getting
ABC Radio's America Works was recorded at the ABC Studios, thanks to our partners at ADT. For 140 years, ADT has helped stop more crime than any other home security company. It's no wonder 5 times more people choose ADT to protect their homes. Visit ADT.com to learn more.
That black boys, followed by black girls, are much more likely to be suspended or expelled or punished or put into special ed for behaviors that are at root mental health problems. And the comparisons, demonstrate that it's at a much higher rate than it is for white kids. Some parts of the country that includes brown and Latino kids as well. So the assumptions that this is a child with a disorder or this is just a disorderly child stand behind so much of how we treat kids. And so much of the point you were making about parent management, years ago I studied a lot of work about, how you build children's vocabularies. And, it's one of the reasons why I do a lot of the pushing of reading, talking, singing to your kids. But for a lot of low-income, highly stressed families, the verbal interactions are predominantly negative. Right. Don't do this. Don't go there. You're going to get in trouble. You stop that. And it's not out of malice. It's out of a sense of trying to protect and in the best way you know how to sort of guide and discipline your child. But with that constant negative messaging and with the assumptions that kids often unfortunately are tagged with when they go into schools, the problem becomes greater, because what could be a mental health problem does, as Harold said, evolve into a criminal justice problem. And then young people are really lost, right? Because, we deinstitutionalized people back in the 70s, right? With the promise that we were going to have more community facilities and care-based treatment, which of course we never came up with to the extent that was needed. So now jails and prisons are basically our mental health holding facilities without adequate treatment, and that's particularly tragic for kids.
I'm going to ask you one last question.
Okay.
I know we just have a minute left. We're going to get some free advice from Dr. Koplowitz right now in the form of this question from Belinda Luscombe from Time. This is right off the news. What should parents say to kids who are watching the stories, both boys and girls, about sexual harassment?
Right. So I think
you can solve that in about 90 seconds,
sure,
right?
Sure.
Perfect. That's what I thought.
So I think that there are teachable moments, and that parents, the number one thing I would always tell parents is not ignore what's going on in the news. Don't think your kid's not hearing about it, even if they're young children versus teenagers. Because if you don't talk to them about it,
they're all hearing about it.
Somebody else is talking to them about it, and it always comes out worse when someone else is talking to them about it. So I think that it's a matter of having a discussion, particularly with a teenager, about the facts of what's going on, but more importantly, behavior. And that this is the moment, I think, where parents should talk to their daughters and their sons about what is appropriate and what it means to ask for permission and what it means for someone to deny you permission, and respecting somebody else's as a person, but also respecting their body, their rights, their space, and have a discussion with them. Because I think the first part, before you give them your opinion, is to hear their opinion. And their opinion might be something you'll find very objectionable, and that's okay as long as you can carry it out and discuss it, and then share with them what you think is the right kind of behavior. I mean, this is something. This is not going away. This is actually, in my opinion, one of the best things that's happening in society, in the respect that it's a watershed moment where women and some men, it seems, have been kept in the dark and shame instead of being able to speak about this. And I think this is the kind of thing that could change our culture. But if you don't have parents talking about it and discussing it and validating it, I think it's a lost opportunity.
Great, thank you. Thank you both. I'd like to thank you all very much for sharing this hour with us. If you'd like more resources on youth mental health, you can go to Harold's website, childmind.org. And thank you, of course, to Secretary Clinton for being so generous with your time and, frankly, for your legacy of putting children and families first. So really appreciate it. To stay in your seats so that we can let Secretary Clinton and Dr. Koplowitz